Hello, I'm Vladlena Eunus, a certified nurse practitioner. I would like to present my quality improvement project that I conducted at the Premier Pediatrics Clinic in Ocala, Florida from January 2017 to the end of April 2017. The topic of the project is effectiveness of interventions to increase compliance with vaccination. According to the Centers of Disease Control and Prevention, vaccination is one of the most powerful and cost-effective interventions of all our time. It is estimated that about 21 million hospitalizations and more than 700,000 deaths of children who were born during the last 20 years will be prevented by vaccinations. According to the evidence, the recent outbreaks of vaccine-preventable diseases were due to increased rate of refusals to vaccinate. Research shows that more than 2 million children in the United States were not vaccinated in recent years, including 2 to 4% of kids living in Florida. Approximately 25% of children residing in Marin County of Ocala, Florida, denied vaccination last year. Information obtained from the EMR report shows that 3 to 4% of patients at the Premier Pediatrics Clinic in Ocala, Florida, did not receive their last doses of hepatitis B, DTaP, MMR, varicella, or polio vaccines, and 59% of patients did not receive their second dose of hepatitis A in 2015. Evidence-based information that communicable infectious diseases still exist and recently caused disease outbreaks all over the world proves the need for actions to increase compliance with immunizations. The overall purpose of the project is to increase compliance with immunizations, avert the risk of vaccine-preventable illnesses, and promote the health of children at the Premier Pediatrics Clinic at Ocala, Florida, as well as protect other citizens of our community from vaccine-preventable disease outbreaks. The study design is a quality improvement project with a retrospective chart review, and participants are pediatric patients from birth to 18 years old and their parents and caregivers. The setting is Premier Pediatrics Clinic in Ocala, Florida. At the beginning of the study, we plan to include boys and girls from birth to 4 years of age and their caregivers. However, because the rates of Gardasil administration were low at the clinic and many parents were interested in receiving more information about the HPV vaccine, pediatric patients from 4 years of age and teenagers and their caregivers were included into the study. The total number of participants was approximately 4,000 to 5,000 children and their caregivers. The interventions included patient-parent questionnaire to identify possible barriers to vaccination that are prevalent at the Premier Pediatrics Clinic, educational session with other healthcare providers and assisting personnel, educational interventions that were introduced to the participants of the project included lecturing, consultations, patient-friendly handouts, information posted on the Premier Pediatrics patient portal, multiple posters on the walls of the waiting room and examination rooms, contest for best picture poster about vaccination. A reminder recall system interventions included email blasts, reminder cards, and reminder calls. The following 3 slides will show the examples of interventions that were implemented at the Premier Pediatrics Clinic. This is the questionnaire that was introduced to the parents and caregivers of the clinic to identify possible barriers to vaccination that were prevalent at the Premier Pediatrics Clinic. According to the results of the questionnaire, the majority of the participants who refused the vaccination, about 80% of them, were afraid of possible side effects of the vaccines, including fear of potential link between the MMR vaccine and development of autism. To address this issue, multiple colorful patient-friendly posters were made and applied in the walls of the examination rooms in the clinic. Handouts and consultations were provided to the parents and caregivers who had questions about the side effects of the vaccines, especially MMR vaccine. These are the examples of slides from the PowerPoint that was presented to the medical assisting personnel and other healthcare providers at the Premier Pediatrics Clinic to teach them the right way to speak with parents and caregivers about recommended vaccination and encourage them to vaccinate their children. A contest for the best patient-made poster about the importance of vaccinations and diseases they prevent was planned to aid in the process of improvement of the people's attitude toward the immunization program, increase people's interest to make them active participants of the project, and improve public trust in the evidence-based data. These are the examples of the posters, email blasts, and handouts that were provided to the parents and caregivers of the clinic during the project implementation. It was noted that posters should be colorful, attracting attention, and be situated in the eye-catching places on the walls, such as near the chairs where the patients and parents were sitting, in the toilet walls and doors near the checkout areas, and etc., to be effective. Email blasts contain data from the app Vaccines and cdc.gov website. Information included reasons to get the vaccine, its possible side effects, ways to conduct infectious disease, and when the vaccine is recommended to be given. Most important data was highlighted in the text. Also, distribution of a book written by Heidi Markov, What to Expect, Guide to Immunizations, had a great success and helped to encourage some parents to vaccinate their children. I would like to thank everybody who helped with the project implementation. My instructor, Dr. Huey, and I got lots of support and help from the administration of the Premier Pediatrics Clinic, especially my preceptor, Dr. Eunus, and managers, Farid and Sonda. Other healthcare providers and assisted personnel of the clinic also provided great support. Also, a representative from Merck Company, who is distributing vaccines, he paid much attention to the project. He brought many posters, booklets, and handouts about the vaccination and diseases they are preventing, and assisted in collection of information and reading of the results. To collect the information, we used provided checklists to document educational interventions that were introduced to participants, and we also did run the reports from the Florida shorts of 2016 and 2017 and compared them. Preliminary report and post-implementation report from the Florida Shorts Registry were compared. Although the number of the patients at the Premier Pediatrics Clinic during the year 2016 and 2017 increased, the percentages of the data evaluation were counted from the number of children that were assessed. So the data is compatible according to the Merck representative who helped to obtain these reports. According to these reports, the changes in the administration of most of the vaccine is noted. The decrease in the rates of administration of some of the vaccines explains the need for further research and study of effectiveness of interventions. These are the rates of vaccine administration for the children from 13 to 17 years that were also obtained from the Florida Shorts Registry. The study showed that active immersion into multiple educational and reminder recall interventions may help to increase the rates of vaccination, reduce parental resistance, and enhance protection of pediatric patients from communicable infectious diseases. Further research is recommended to identify more effective interventions and approaches to overcome parent-patient resistance to vaccination and increase compliance with the immunization schedule. Thank you for your time and for watching my video.